So welcome everybody to another Zoom session. So nice to see so many of you again this morning. I think a really great and important topic today. So I think we should try and get right to it because I'm sure there's going to be a lot of conversation. And I'm delighted we've got a real expert in the area with us today, Elizabeth Scarlett. Thank you so much for joining us. Elizabeth,
thanks for having me.
I'll let you introduce yourself a little bit more and then give us a bit of a talk on burnout prevention. And we're going to talk about building resilience for long-term care staff and administrators. So with that, I will turn it over to you.
Great. Hi, everyone. Thanks for being here today. All right, just a quick disclosure. I am a co-founder for a for-profit business called the Behavior Elevation Academy, which focuses on burnout prevention. So just wanted to disclose that it is a for-profit business, and I'm going to be making reference to it later. Otherwise, there are no disclosures or conflict of interest or potential bias. I just wanted to say a couple of things about myself. I'm a registered psychotherapist and clinical supervisor in Ontario. I've been working in community mental health and frontline work for over 15 years. So while I don't have any direct long-term care experience, I have worked in residential settings, and I know what it is like to work in an environment where people live and the connections that form within that. So that is something I can relate to on some degree, even though there are a lot of differences there. And some of my specializations include suicide intervention, complex trauma, substance use, and burnout prevention, which is obviously our topic for today. And one thing I also want to point out is I've experienced burnout firsthand. And the reason I disclose that is because it took me a long time to realize that I had experienced burnout. So I think it's a really important thing that we talk about the signs of burnout and be more open to recognizing what those signs are so we can take better care of ourselves in order to take great care of the clients and patients that we work with. So our objectives for today are pretty simple in the time that we have. It's to better understand the phenomenon of burnout and to introduce some practical strategies for preventing burnout. And I hope we're able to talk about that further in our conversation as well, because I introduced some simple strategies, but I hope we're able to flesh that out in the time we have later. Okay, so I think now we have a couple of poll questions. All right, so this is pretty basic. I just want to know what you think of, what comes to mind when you hear the word burnout. It's a topic that's been around for a while, but oftentimes actually defining it's a little tricky. Yes, I see exhaustion, overworked, stressed, lots of stress depleted, for sure. Trouble empathizing, overwhelmed, moody. Yeah, we're going to touch on a lot of these points. This is really, yeah. Fatigue. And I just wanted to get a sense from the group if you've ever experienced burnout. Okay. So as we can see, it's not so uncommon. And right in this moment, how burnt out would you say you're personally feeling? You can see the options everywhere from not at all to just feeling toast. Okay. A lot of ups and downs right now. Okay. I think this is really reflective of the environment that we're in right now. That those up and down feelings are coming about. Okay, so the first thing I wanted to share with you is the burnout hexagon. And really, we look at burnout along 3 spectrums, and this just kind of puts it all together in one place. We're going to go in a little more detail about each of these, but it's energy to exhaustion, involvement to cynicism, and efficacy to inefficacy. So you can see if you're more toward the top of the burnout hexagon, you're thriving, the resiliency is there. If you're toward the bottom, those are signs of burnout, and you may be showing burnout in one or more of those elements, and sometimes it shows up more at different times. Okay, so we're going to go into a little more detail about each of these. Energy to exhaustion is what most of us think about when we hear the word burnout. So when we did the poll, a lot of words about feeling depleted, exhausted, all of those things. It's best to think of this as the emotional element of burnout, which we don't necessarily do. We tend to think of tiredness as a physical kind of thing, but this is the emotional element. And it's usually the easiest to spot. It's the easiest to recognize in ourselves, and sometimes other people see this in us, but it's also the easiest to just write off, right? Well, of course I'm tired. I just came off a long shift, or I've got a lot on my plate right now, or there's so many stressors, and just kind of ignoring that, like, oh, well, once I get a vacation, which is unheard of right now, or once I'm able to get a little bit of a break, I'll be better, instead of recognizing that the exhaustion is over a period of time. And I just like to point out a few signs of exhaustion. So like I said, it's not about just being tired, it's feeling completely drained. And for a lot of people, it shows up physically as headaches or digestive upset or muscle aches that are not explained by other things. And that feeling overwhelmed, right? For a lot of people, there's a sleep disturbance that comes up. So either having trouble falling asleep or falling back asleep, and this becomes a vicious cycle, right? We're tired, and then we have trouble sleeping, and then we're more tired, and it just keeps coming, right? And a big one for a lot of people is not feeling like they have enough energy for the people or the things outside of their work. So when they're at work, they feel like they have the energy they need to get through the day, but it's outside of work that they're just spent and not really able to enjoy what they normally would. Involvement to cynicism, forgive the picture. When I was in burnout, this is how I was walking into a staff meeting. Maybe not visibly, but that's how I felt inside. And it's the mental element of burnout. And it's really marked by how we're responding to other people. So often other people will notice this before we do, right? And some of the signs include actually feeling a level of detachment from the work that we're doing, and kind of like wondering what the point is. I keep doing the same thing over and over again, and like, is it really helping anybody? And for a lot of people who are feeling cynical, they start really daydreaming about leaving their job or even their career and taking a new career path, and they get to that mental space on a regular basis. And this is where the anger and irritability starts to show up. And for a lot of people, for a lot of helpers, this stays internal, or it comes through in some other people in our life. Every once in a while, it comes through with the people that we're helping, but that's usually a late stage thing. So what happens more often is becoming skeptical or having difficulty trusting the people that we're working with. And that includes the patients, right? So when we kind of go, oh, he's doing that on purpose to upset me, right? That kind of language is often a sign of cynicism. The third area, efficacy to inefficacy, is usually the trickiest one for people to define and wrap their head around. But really it comes down to the behavioral element of burnout, and it's how we're responding to ourselves. So this one's hard to spot because it's a lot of the internal monologue that we have. And what it ultimately comes down to is feeling unproductive. Sometimes it's literally being unproductive, but again, in helping professionals, it's usually we're just as productive as we ever were, but we're doubting our productivity, and it becomes something we become preoccupied with when we're in this burnout. So again, feeling unproductive, even though I'm busy, even if I'm getting a lot done, not feeling like it matters so much, and questioning the value of my personal work. So when we're in cynicism, we're sometimes questioning things more globally. This is about, am I really bringing much to the table? And for a lot of people, this is where imposter syndrome shows up. It's kind of saying that I'm not good enough, or are people going to think I'm a fraud? And I really want to highlight the feeling less appreciated, because right now in long-term care and how certain things are being portrayed in the media, unfortunately, a lot of negatives that are small examples are being highlighted, where the very good work that so many people do is not necessarily recognized as much. That's not as good news, right? So that people don't focus in on that and things are painted with a broad brush. So that feeling less appreciated, I think, is probably something that's very present right now. And also, this is where we get into the comparison game. We're looking at ourselves as compared to other people and often feeling like we're just not measuring up. Okay. There's just the hexagon once again for future reference. And so let's get into talking about resilience, because this is what we really need here. The way I look at resilience is more about a behavior rather than a personality trait. Often we look at resilience as somebody is resilient or they're not. But I like to think that we all have the capacity for resilience, which is our ability to effectively adapt and cope with adverse events and change, right? Which we certainly are getting a lot of examples of that right now. But what behaviors are we taking to move through that and continuing to take care of ourselves? That's our real measure of resilience. And I think for a lot of us that work in helping professions, we put on the brave face, we pretend that things don't faze us. I've seen it all. I've been doing this for a long time. We get into that mentality. But the reality is resilience isn't about pretending that we're not affected, right? It's about working through the difficult changes that come up for us. So I want to focus in on some coping strategies, and I've kept it really simple, and that's intentional, because I want us to consider that a lot of you are working long shifts, are working very frequently, and I want you to tune in to some of the basics that are going to help you get through those shifts and help you at the end of the day. So I've divided coping strategies into 3 categories, and I've paired them with each of the elements, each of the burnout spectrums. So the first one is distraction, and oftentimes distraction gets a bad name, and that's because we often fall into distraction and it becomes this autopilot or zoning out that we do. We just reach for our shadow comforts, and we do so without intention, especially when we're feeling incredibly exhausted. But we can really use distraction as a tool when our mind is racing, when we have too much on our plate, and when we're feeling overwhelmed. So I like to think of it as the difference between I'm going to catch a show on Netflix and have a small bowl of chips versus binge watching Netflix and waking up with like a bunch of orange dust all over you because you've just finished off a bag of Cheetos, right? So it's not so much about what you're choosing to do, but it's how you're choosing to do it and doing it with intent, intentionally giving yourself a break and escaping the moment. That's how you can use distraction as a tool. So it might be good to look at the ways that you typically distract and see, can you do it in a more intentional way? Because most of us are pretty good at distraction. Moving away from cynicism and toward involvement, I like to use coping strategies around self-soothing. And I don't think we spend enough time doing this. And this is really about enjoying the moment, when we need to unwind, when we need to be comforted. And so the strategy here is about focusing in on the 5 senses. What visually would be appealing and comforting to me right now? What about sounds? What about tastes and smells? Smells especially are incredibly powerful, right? What textures would feel good? And I like to make a note, because when we talk about soothing, a lot of people think of a spa and that like trickling water fountain and that instrumental music, but that's not always what's comforting to us. You know, sometimes a heavy beat or an intense workout is actually exactly what we need to soothe ourselves and feel comforted in any moment. So this is incredibly individual. And last but not least, in order to increase our efficacy and that feeling of productivity, grounding is usually the best type of strategy. And you can use any of these strategies at any time, but grounding is about being in the moment and orienting ourselves to the present. And when we are so overwhelmed, when we are so escalated and we feel like we can't take anything more, if we're able to do a little bit of grounding, that allows some room for us to be able to take better care of ourselves and self-soothe. So examples of this include counting, breathing, mindfulness activities. There's a whole lot of different ways to just bring yourself into the moment and being able to brainstorm what sort of grounding activities, what sort of things can you do on shift when you're taking a break, or even when you're in the middle of something, but can you catch a moment to just do a deep breath into the belly or box breathing. So this is such a key one in order to help the other strategies to really pay off. And so here I've included a few additional resources and links. I took a look at the CLRI site that's linked here, and there's so many incredible resources on that. So if you haven't checked it out, it's very much in line with some of the things I've talked about and ways to soothe and ground yourself. Also the link to my business, the Behavior Elevation Academy, which again is burnout specific, and we have a free Coping with Stress of COVID-19 mini course. It's all audio. You can download it and just play it. So like you can do it while you're washing dishes, and it adds some more tools and strategies that focuses in on our core values. And then I put some mindfulness apps that a lot of my clients and a lot of people I know find it's useful that you can download on your phone. Many of them have free options that might be a little more limited, and as well as some paid options. But you can also find a lot of free mindfulness apps on YouTube and things like that. So I would greatly encourage a little research there, even if it feels a little woo-woo to you. Like listening to a guided meditation or checking it out a bit can actually just kind of bring the intensity down a little bit. So I really appreciate your time. My contact info is on here. If after today you have some questions, you want to know more, you want to reach out, I am happy to be a support. And I really look forward to the discussion we're about to have. So thank you very much.